Good afternoon. My name is Alex Rossman. I'm the External Affairs Director for the Michigan League for Public Policy. Welcome to our Homes for a Lifetime panel discussion on housing needs of Michigan seniors and residents with a disability. Again, I'm the External Affairs Director for the Michigan League for Public Policy. There we go. All right, let's start again. Good afternoon. My name is Alex Rossman. I am the External Affairs Director for the Michigan League for Public Policy. I appreciate everyone joining us today for our Homes for a Lifetime panel discussion on housing needs of Michigan seniors and residents with a disability. And joining us today, we have Carmen Johnson, who will be doing our ASL interpreting for our discussion. And she will be on at all times as we work through our panel to help communicate our discussion with as wide an audience as possible. So thanks again to everyone joining us. We also today are going to be doing what's called visual description, where we explain how we look for viewers that might not be able to see us online. So I am a 43-year-old white male with long dark hair pulled back, a very full dark beard. I'm wearing a blue shirt with white flowers and a blue blazer. My background is a large banner that has my organization's logo on it and a cool painting of the Capitol. And again, appreciate everyone joining us today for this important discussion. The League recently did a great report that is the catalyst for this conversation. We've got a lot of great partners and organizations joining us as well. So we'll go ahead and get into the discussion today. We're going to have a brief introduction of each person and the organization they represent, and then we will get into some questions. So please be thinking about questions you may have. We will have a question and answer section for the second portion of our discussion. So first, would like to bring on my colleague at the Michigan League for Public Policy, Julie Cassidy.
Thank you so much, Alex. I'm Julie Cassidy. I'm a policy analyst here at the League. My pronouns are she, her, hers. I'm a white woman in my 40s with brown hair and glasses, sitting in my home office. I want to thank all of our panelists so much for being here today. They were all instrumental in putting this report together. And I'd also like to thank Carmen Johnson for providing interpretation services today.
Great. So we'd like to start by talking about the report that you recently put together, Homes for a Lifetime. We'll put a link to that report in the comments for everyone watching. But if you could just give us a brief overview of the recent report and some of the key findings and data points in that.
Sure. As I'm sure everyone watching today is aware, Michigan is experiencing a dire shortage of affordable housing, and the greatest impact is arguably on disabled people and older adults who are more likely to live in families with extremely low incomes, and they may need certain design features or supportive services that just aren't part of most housing options that are available to us, at least not at an affordable price. I do want to be clear, however, that this doesn't mean that their housing needs are special or extra. Everyone needs a home that they can afford, one that is safe and accessible and that works for them and their family. So this really does affect everyone. We're all growing older. If we aren't already disabled, we could be in the future. And many of us will be caregivers at some point to elderly or disabled loved ones. Michigan is one of the fastest aging states in the nation, and the costs of long-term care are continuing to rise. It's really important to acknowledge that structural racism, ableism, and ageism are very much intertwined as a result of policy choices, many of them related to housing specifically. There are significant racial disparities in disability rates. For example, redlining has segregated people of color, particularly Black and Indigenous people, in neighborhoods where they face barriers to healthcare access and greater exposure to conditions that cause disability. For example, exposure to pollution, inadequate access to healthy food, exposure to toxic stress, things like that. Of course, disability becomes more prevalent with age, and those racial disparities also grow wider with age. So we have to be very conscious of how all of these dynamics are interacting with one another as we craft solutions to the housing crisis. Unfortunately, the historic resources that Michigan has received under the American Rescue Plan Act, or ARPA, have given us an incredible opportunity when it comes to advancing housing justice. So, our recommendations on that front include investments in alternatives to institutional care, particularly home and community based services, improved safety and quality of life for people who are still living in congregate settings like nursing homes, new tools to more easily connect people with affordable, accessible, and inclusive housing, ensuring that subsidies to affordable housing developers push them to ensure that the accessible housing they build is fully integrated in the community rather than segregating disabled and older residents in specific buildings and neighborhoods. And finally, we are thrilled to support Senate Bill 949, recently introduced by Senator Winnie Brinks, to provide for eviction records to be sealed under certain conditions. And we think all of these things will promote housing stability and affordability for older adults and people with disabilities, which is necessary to valuing all members of our communities.
Great. Thanks, Julie. This is Alex again. Really appreciate the report and the policy recommendations, and we will get into those a little more during our discussion. But next, I'd like to bring on one of the partners that helped with the report, Casey Messiter, analyst with Detroit Disability Power. Hi,
Thank
Casey.
you, Alex. Thanks, Julie. This is Casey Messiter. I'm the policy analyst at Detroit Disability Power. I use she, her pronouns and a short visual description. I am a mid-20s young white woman with short, curly brown hair. I'm wearing a brown sweater and glasses in front of a plain wall behind me.
Great. And a little bit about Detroit Disability Power and the work you do.
Yeah, thanks, Alex. This is Casey. Detroit Disability Power is a membership organization of disabled Detroiters and Michiganders. We organize with our members through various activities like our action teams, of which we have a housing one, I'll plug, community events, and policy advocacy in order to build our own political power.
This is Alex. What are, as we look at the report and the focus on housing, what are some of the housing challenges for people with a disability? What are some of the personal experiences that you've heard about in your work?
This is Casey. That is a question with many, many answers, right? People with disabilities deserve accessible, affordable, permanent, inclusive, integrated housing. And we know that our current housing options don't reflect the diverse needs that our community has. People with disabilities experience compounding effects of one, access barriers, and then two, financial barriers. And we shouldn't have to choose between housing and other necessities like food and healthcare, right? So actually, before I started at Detroit Disability Power, I worked up in mid-Michigan as a hospice and home care worker. And I think that's where I had the most experience seeing how many diverse housing issues our communities experience. I'd like to tell a quick little story from one of my patients. We'll call him Robert. Robert was a diabetic man in his 50s, right, in rural Michigan. And he required having a lower leg amputation and the use of a wheelchair. In his house that he had been living in for years and years and years with his wife and young 5-year-old daughter was inaccessible. And he wanted to stay there, as we all want to stay in our homes. But there are no good options right now for funds to modify homes, to repair homes so that we can remain in them. Oftentimes, only homeowners can get those. And oftentimes, if a home is deemed to be in too much disrepair, that will also disqualify people from getting those home modification funds. And of course, he wanted to stay at home with his wife and partner, but he was faced with this choice of receiving that necessary care that he needed in a care facility or remaining in a home where he could not receive the care that he needed, right? And we should not have to choose between housing and necessities like that, nor being able to remain in our homes and communities where we're safer, happier, and healthier. So that's just one example of things that our community faces every single day.
Yes, thank you for sharing that. And yeah, I think it really brings the point home that there's a big population impacted by this. Nearly 2 million Michiganders, either senior age or with a disability. But it also comes back to those individual experiences and needs as well. So I appreciate that, and we look forward to continuing to speak with you in a little bit. Next, we'll bring on Lisa Dedden Cooper, who's Manager of Advocacy for AARP Michigan.
Hi, Alex, and hello, everyone. It's great to be with you. I'm Lisa Dedden Cooper, and I'm Manager of Advocacy for AARP Michigan. And visual description, I am a 56-year-old white woman. I've got long blonde hair with purple on the tips because I am ready for spring. And I'm wearing glasses and a bright blue jacket. Also, you can't see them, but I'm wearing hearing aids under my long hair. I'm joining you from my home office. So behind me, I've got an AARP banner and then a collection of some of my favorite books and favorite photos.
Great, I appreciate that. I really enjoy the purple tips. This is Alex again. Could you talk a little bit about AARP Michigan's advocacy work?
Yes, this is Lisa, and AARP is a nonprofit, nonpartisan organization. We are advocates on behalf of people age 50 and older, and our mission is to empower people to choose how they live as they age. So we advocate on public policy on both the state and federal level with a focus on access to health care, financial security, long-term care, and livable communities. And one of AARP Michigan's current focuses is reforming Michigan's long-term care system. And that's because the COVID pandemic really shined the light on some of these long-standing systemic deficiencies in our existing system. And at the same time, there are now new resources available to to Michigan from the American Rescue Plan Act that really have the potential to help us in Michigan to make some of the long needed reforms to our system.
Great. I appreciate that. And we're definitely going to talk a little bit more about the American Rescue Plan Act dollars and how those can be used. So we look forward to continuing the conversation with you momentarily. With that, we will bring on our next panelist, Paul Eklund, who's an ADA specialist and systems advocate with the Disability Network for Southwest Michigan. Welcome, Paul. If you could just introduce yourself briefly.
Hello, Alex and everyone else. My name's Paul Eklund. I work with Disability Network Southwest Michigan, which is one of 15 centers for independent living throughout the state of Michigan. My visual description is that I'm a 67-year-old white male with gray and brown hair. I've got a light blue shirt on, clean shaven, and a virtual background of a brick wall.
Great. So tell us a little bit more about what Disability Network Southwest Michigan does and what your work there entails.
Okay. Disability Network is, because it's a center for independent living, which is about like 400 of them throughout the United States, they function on core factors. One is information referral for anything dealing with disability. Another one is a specialist that focuses on independent living skills. We have advocacy and community education and peer support groups, such as like our brain injury support group and our women's support group.
Great.
Main things I've been working on are numerous bills in the House and in the Michigan House of Representatives and in the Senate. And that have to deal with disabilities, trying to see about moving those forward.
Okay, thanks. This is Alex again. Paul, I know that you've been working in this this policy area on housing needs for residents with a disability for a long time, and have a lot of experience. And so I was curious if you had any insights either on improvements you've seen over your time working on this, or perhaps things that have declined and need to be addressed again. But just kind of a landscape scan over your time and career on policies related to housing needs for people with a disability.
Okay. One thing that's been affecting basically the whole nation is homelessness. And a lot of people that are homeless have disabilities of various sorts. The state of Michigan has pushed forward for the first time a state housing plan. Michigan State Housing Development Authority, MISHDA for short, created a Partners Advisory Council, of which they asked me to be one of those members to create this state housing plan. It's going to be coming out at the Michigan Housing Conference in early May. That's when it's going to hit the basic public. The primary focus seems to be on building more affordable housing and equity, because there is a lot of racial injustice done through, like what was mentioned earlier, through redlining and disparate impact of where people didn't want to have various like housing projects in their backyards. There's a lot of Nimbyism. And they're trying to address that through creating the general state housing plan.
This is Alex again. Thank you for that. I think Nimbyism will be one of our questions momentarily to explain that acronym. I'm familiar with it through conversations with Julie, but that is kind of a quick introduction of each of our panelists. I honestly could spend 30 minutes to an hour with one-on-one conversations with each of them, but trying to give our viewers a little bit of a taste of all of the different work that you all are doing, and all of the concerted effort that went into this report, and now transitioning into the advocacy efforts around those policy recommendations in the report. So at this point, I'd like to open it up to our audience to see if anyone has any questions for our panelists. You can post your questions in the comments. If possible, if you do have a specific speaker in mind, if you could note that as well. And while we wait and see if we have any questions, I will bring Paul back on and ask that question. If you could just explain what Nimbyism stands for and how that plays out in housing policy discussions.
Well, let's see. Nimbyism stands for not in my backyard. There used to be a thing like what happened in Chicago of when housing projects were built. It was all for one specific population, like say those that were poor and needed affordable housing. It was 100% affordable housing. And then they put it into a needy neighborhood that didn't have many amenities like theaters and grocery stores and that sort of stuff. And when they found out that it was really creating segregation, they started looking at being able to put housing projects into more affluent neighborhoods. And then Nimbyism started happening, and it's happening a lot with racial discrimination, with the redlining of where people thought that if you allowed different races into the white neighborhoods, that it would decrease housing stock prices. They'd lose the value of their home. It would start going down the hill, which is totally false. Nimbyism starting to come out more now too, as we try to keep that disparate impact from happening. The affluent neighborhoods don't want affordable housing complexes beside them, and one of the answers to that is having mixed income housing units, so that you get a wide variety within apartment complex.
Okay, great. Well, I appreciate that. Again, we're taking questions for our audience. If from our audience, if anyone has any. Next, I'm going to bring on Lisa from AARP Michigan and ask her to discuss some of the unique housing needs for Michigan seniors, that population in particular.
Yes, thank you, Alex. This is Lisa again. And when it comes to housing, AARP's goal is to empower people, more Michigan residents, to age in place safely and independently where they want to be. So in their own homes, or in any case, in a setting of their choice. And two issues that older adults may face are, first, a need for more accessibility features in their housing as they age. And second, they may need assistance with certain personal care tasks. So in terms of accessibility, they may need things they didn't necessarily need before, like simple things such as grab bars for help with balance, but they also might be some things that require more extensive modifications to allow for the use of mobility aids like walkers or wheelchairs. And then in terms of the assistance that people may need as they age, assistance with personal care tasks, that's where the terms long-term care and long-term services and supports come in. Those terms refer to this broad range of both paid and unpaid medical and personal care assistance that people may need maybe for several weeks if they're recovering from an accident. It could be months, it could be years. And they need this assistance because for that time period, they're experiencing difficulty with these self-care tasks. And it could be a result of aging, chronic illness, a disability, or an accident like a fall. But those are two things that, while we have a lot of intersectionality with the other populations, including people who have been disabled from younger ages, those are two things that we tend to see older adults needing to pay more attention to.
All right, great. And I see that we do have a question from Wendy Liu. Would it be possible to talk a little bit about what existing efforts there are to establish affordable, accessible housing and where the weak points, strong points of those efforts are? And this is a great question, both with some good news recently coming out of the legislature and also some additional advocacy opportunities with remaining ARPA dollars as well as the 2023 state budget. So Julie, if you could speak to that a little bit, and then Casey, I believe you have some thoughts as well.
Sure, this is Julie again. Was it last week or the week before? Losing track of time now. The legislature passed in a bipartisan fashion a supplemental appropriating some of the fiscal relief funds that Michigan received under ARPA. And included in this were substantial housing resources that at a level that we really haven't seen in many years. Which is great. There's a total of about $100 million that will go to the Michigan Housing and Community Development Fund, which is Michigan's housing trust fund. This fund has only been funded twice since it was created back in 2008, and it just received a few $1 million every time. But the money that was in that fund was used very successfully, leveraging as much as $11 in additional investment for every $1 of state money. And the populations that tended to benefit from the homes constructed or rehabbed with this money tended to be people experiencing homelessness or on the brink of it, people with disabilities, older adults. So some of the people with the greatest housing challenges in our state. And so we're really thrilled that the legislature has seen fit to provide some more support this year for that fund using the ARPA dollars. I do want to stress, while this is a great step, this is not it really should just be viewed as a down payment on what is actually needed, because we have been underinvesting in housing in our state for so long. So we hope that this will kind of spark a conversation about the need to find a permanent, ongoing revenue stream for this fund, so that we can continue to meet the needs of our residents with regard to housing into the future.
Thanks, Julie. This is Alex again. I was talking to a reporter yesterday about the supplemental, and he kind of asked, is this enough? Is your organization satisfied? And I said, we're very excited about this amount, but there's still a long ways to go, and hoping that this can be a building block for continued bipartisan work on additional ARPA money or the state budget. So Casey, would you like to weigh in on Wendy's question as well?
Yes, Alex, thank you. This is Casey. Similar to what Julie was talking about, and I'll just add another example on the more local level. At the state level, Julie was talking about the Housing Trust Fund and the importance of that. The city of Detroit also has its own housing trust fund. It's called the Detroit Housing for the Future Fund. And what that is a combination of private investment that is invested into affordable housing development and preservation across the city of Detroit. And what it does is it provides private grants and low interest loans to developers who are going to build affordable housing in the city of Detroit to encourage that. The important thing to remember with this is that these, at least with Detroit's, and Julie, correct me if I'm wrong with the states, it's specifically affordable housing, right? And what we're trying to do is create this awareness that affordable housing is not the only need. We also need affordable, accessible housing. So many of these units that are developed are required to be accessible, but that number is way lower than it should be. And I can't quote that right now. I can link that maybe later on what those exact numbers are, but we need it to be a lot higher. So this is one area for policy advocacy where we can go to meetings, to discussions with these housing trust funds and say we need more, a higher percentage of these units to be accessible and affordable.
This is Alex again. I appreciate those answers. We are putting links to relevant materials in the comments, but we'll continue to populate this after our live discussion is over. We are also recording, so this will be available later. You also can ask questions later if you don't happen to be watching this live, but are still interested. If you just post a question in the comments at any time you're watching this, we will get back to you quickly. So next, I'd like to bring on Lisa to answer our next question. Could you talk about how better supporting the housing needs of seniors and Michiganders with a disability has broader benefits on communities, businesses, the economy, state budget, et cetera? You know, you and I both come from a legislative background, and I'm sure in our work today know that as you're making that case to both sides of the aisle, some of that broader impact needs to be included. You know, different lawmakers are motivated by different things, but some of that ripple effect of benefits really, I think, strengthens those advocacy arguments. So could you talk a little bit about that?
Sure, Alex. Yes, this is Lisa. And, you know, one of the things that, one of the terms that we use at AARP is we talk about age-friendly communities and age-friendly states. Michigan is actually enrolled in the Age-Friendly States and Communities Network. That is something that AARP works with the World Health Organization to administer and provide resources for communities that want to become more age-friendly. But when we talk about age-friendly communities, we don't mean at all elder-friendly communities. It means communities that are friendly for people of all ages and at all stages in life. And one of the things that has been found is that when a state becomes more cognizant, becomes more age-friendly, they attract and maintain employers. And they provide appeal to all ages, not just older adults. Whether you use a wheelchair or you're pushing a stroller, having roads that you can safely cross the street are something that you want. Having green spaces that are safe are something that you want. And when employers in particular are choosing where to locate, where they want to set up and maintain their business, seeing a community or a state that offers these features that people want to live in and live in throughout their lifetime is appealing to them. It brings business in. There's another aspect too that we'll often talk about, which is in terms of older adults. We talk about the concept of the longevity economy. And I think for too long, there had been this thought that having older people in particular, older people, other people with disabilities in a state or a community would create a drain on the economy. But again, there's research. AARP in particular has worked with Oxford University and some other economists to come up with data that looks at this. And they see that, in fact, it's a positive economic driver when you have older adults in particular in your community, in your state. They bring in monies, like Social Security and their savings, the monies that they bring. But more important, in a lot of ways, in terms of how economies function, they spend in their local communities. And that provides a boost for the entire economic health of the state or of those communities.
Okay, great. I did see that we had a question from Melissa with Gongwer, which is a political and legislative newsletter here. Well, you can get it emailed anywhere in the state. They're based here in Lansing. She had a question about what our groups are doing to advocate for better wages for individuals with disabilities. And I appreciate that question. That was something that is also included in Julie's report. And so we'll bring on Julie to answer that question.
Thanks, Alex. This is Julie again. People with disabilities are disproportionately employed in low-wage jobs. And these are also jobs that were at higher risk for coronavirus exposure and also higher risk for layoffs during the pandemic. These are often jobs that just don't pay enough to cover a person's basic needs, let alone support a family or save for emergencies or for retirement. So the League for many years has been very much involved in policies to raise wages and create better working conditions for all people in these low-wage jobs. And so this will disproportionately have an impact on disabled workers as well. Things like raising the minimum wage, advocating for paid leave time, things like that. Something that we specifically called out in the report is that Michigan is one of the states that participates in a federal program that allows certain employers to obtain a certificate that permits them to pay disabled workers less than the minimum wage, less than they are paying other workers. In many cases, these workers end up segregated from workers without disabilities, and they're paid as little as $2.75 an hour. So we feel that this is something that should not continue in our state. We need to adopt policies that acknowledge the value that workers with disabilities bring to the workplace, to our communities, to the economy. And so that's just one concrete example of a way that we can change that.
This is Alex. Great. Thanks, Julie. Casey, do you have anything you'd like to add on that question?
Thanks, Alex. This is Casey. I think Julie did a beautiful job summing up that. I will say the Build Back Better plan did have plans to end subminimum wage federally. That's something that I know a lot of lawmakers are still talking about, as that didn't pass, and a lot of states are taking up that flag and starting to work on that as well, which is good news. I think the piece that I wanted to add, though, as Julie so beautifully wrapped up the policy side of things, is just the cultural shift in talking about this, right? Because a lot of times when those federal pieces of legislation that allow for sub-minimum wage are explained to folks, there's not as much of an outcry as there needs to be. And I think that comes from this underlying idea that people with disabilities don't have as much to contribute in the workplace, whether that's a physical disability, a mental health disability, intellectual developmental learning, whatever it may be. But all of those things are strengths for our communities, strengths for our employers, strengths for our neighbors, our families, right? Because when we learn to navigate the world in a way that allows us to do all that we need to do in our everyday lives, when that world wasn't built for us to be able to do that, that gives so many people with disabilities creativity, innovation, strength, motivation, all of these unique characteristics that employers are looking for every day. So I think in addition to the policy level, there's also this cultural level of change that needs to happen to recognize the value that our communities bring to the workforce.
This is Alex again. Thank you both for that. And, I think I know our organizational culture at the League have been talking with you and your organization quite a bit about just making our work more accessible as well, and just incorporating a broader audience and varied needs around the state. And so appreciate that insight, and, continuing to encourage employers and organizations to embrace that access as much as possible, and appreciate your help in working with us on that. So we have another question from Sam with MERS News, which is also a policy e-newsletter. And her question is, what makes Michigan most distinct when it comes to housing gaps for seniors and the disabled? And what is the state's biggest barrier? And so first we'll bring on Lisa from AARP to take that.
Thank you, Alex, and thank you for that question, Samantha. This is Lisa again. And one of the biggest barriers, I think, to us moving forward in this is that we continue to have in our systems this institutional bias. There is an outdated assumption that the normal in quotes, place for a person to receive assistance with self-care tasks as they age, for example, should be in a traditional institutional setting, think nursing home. But this presumption runs contrary to both public preference and to the core legal principle that individuals should be able to receive services in the least restrictive setting appropriate to the individual's need. And this underlying assumption in our system has led to an imbalance. We have a mismatch between the demand and the supply for services that are available, for settings that are available. When we talk about the different types of alternatives that would allow people to be able to age in place by receiving personal care assistance, long-term care services and supports in home and community-based settings, when we think about, there are all these alternatives that exist in Michigan, but those programs, the different programs that we have, like My Choice and the non-Medicaid services that the area agencies on aging provide, the programs all inclusive for the elderly PACE programs, the Michigan MI Health Link. When we think about these programs, the supply, the access that people have to these services is very limited. The supply of long-term services and supports have just been out of whack with consumer demands for many years. So we for home and community-based services persisting while we have the numbers of people who live in or want to live in nursing homes or traditional institutional settings decline. But part of us continuing to have this institutional bias in our system is that it's easier for people, if you need services, to get Medicaid determination to allow you to go into a nursing home rather than to get services in your home. And it means that Michigan's taxpayers, when we come to the dollars that taxpayers spend in Michigan on these types of services, on long-term services and supports, we still spend about 65% of those funds on traditional nursing home settings as opposed to home and community-based settings where people want to be, and where in fact it would cost less and less money for people to be able to receive their services.
This is Alex again. Thank you for that, Lisa. We'll bring on Paul Eklund again and see if he has any additional thoughts on that question. Again, having worked in housing policy in Michigan for a couple of decades, if you have any thoughts on kind of some of the unique challenges that you've seen in the state and ways we could address those.
Well, one of the challenges is that a lot of the housing stock was built before 73 when the Rehab Act was passed, which demanded that if you use federal money, you'd have to have at least 5% of, like, say, an apartment complex be accessible and another 2% sensory accessible for sight and hearing. The thing is that if we can change the way that we ask developers and builders to make readily adaptable housing. For instance, the Fair Housing Act has a lot of parts in its law to mandate that at the entry level, you got to make it with what is called Type B dwelling units, which basically looks at being able to have those dwelling units readily adaptable to being somewhat accessible. But if we could change that to be more like Type A dwelling units, which is much more readily adaptable, doesn't have the grab bars and it doesn't have the open space under the sink, but what it does have is blocking in the walls that already exist so that you could just readily put up grab bars if you wanted to. It doesn't stop anybody from, it doesn't segregate any part of the population from having access to that housing. Whereas if you don't do that, it's going to be rather expensive to rip out the walls, put in the blocking, build the walls back up, and then put on the grab bars. Same thing like with the kitchen sink. The flooring around the kitchen sink would go under the kitchen sink so that if you take the cabinet doors off, you still have easy access to the sink and have that knee and toe clearance to be able to get there. Need to think more about having the contractors and designers, the architects, think with that ability to readily adapt housing to be accessible so you can much more easily live in place. Some of the barriers that, other barriers that have been addressed by some of the cities in Michigan is that they recognize that there is a real need for affordable and accessible housing. And so they passed housing millages. We've been trying to get that to happen with the state, as was mentioned by Julie earlier, to try to get a permanent funding stream for the Michigan Housing and Community Development Fund. But there's been a lot of resistance to that, especially. It's great that we've got some of the AARP money going in there to help with that. But once again, that's a one-time shot. Need a permanent funding stream for that, because as these homes age, for instance, if they were built before 73 or even like 76 when the Fair Housing Act was passed, as people age, they acquire various disabilities or lose capacities, and they want to stay there in place. But if you're on retirement sort of funding, there's limited funds to be able to modify the house. So one of the nice things is that Housing and Urban Development HUD has made a funding stream available for various agencies and states to apply for and have money for home modification. And that's one of the things that these millages will do. That's in like Kalamazoo, Grand Rapids, Ann Arbor, have all pass those to be able to build that more affordable, hopefully accessible housing, so that people can age in place and that they can afford it. And affordability is basically a thing of where you look at somebody's income of whatever it is, and only 30% of the income is going for that rent or for house payments, that sort of stuff. So the rest of it can be spent on other things like being able to have transportation, medical expenses, food, clothing, all that sort of stuff. Whereas a lot of people are burdened by heavy rents where they can't, like, say if you're on SSI and you're only bringing in about $760 some odd a month, and your studio apartment costs $600, you've only got about $160 to spend for everything else. That's much more than even, that's like 80% of your income just going for rent. That's not like 30%. But those are some of the barriers that we're facing that we've got to try to see about being able to build more affordable housing, build it equitably so that it's evenly and not just sort of like built for more affluent workers, that sort of stuff, and for various race and disability discrimination that's been taking place.
Yeah. This is Alex. Thanks again for those questions. As we wrap up, I'd like to pose to each of our panelists who have joined us today. We've been so grateful for your time and your insights. I'd like to close, as we all work in advocacy in particular, I'd like to ask each of you what's your kind of ask or appeal to policymakers from an advocacy standpoint, either a specific piece of legislation or funding priority, or just a general consideration you'd like to see for seniors and people with a disability. So we'll start with Lisa and then go to Paul, and then we'll bring on Casey and Julie.
Well, thank you, Alex, and thank you for that question. This is Lisa again from AARP, and what we are urging policymakers to do is make use of the one-time funding that is now available to Michigan under the American Rescue Plan Act, and in particular, to use it to shift this norm away from favoring institutional settings by encouraging more capital investment in alternative long-term care delivery models. There are tried and true models such as greenhouses and PACE, as I mentioned, as well as newer models such as something called SASH, Support and Services at Home, that provide independent senior housing with coordinated supportive services. In particular, this greenhouse model, which has been around a long time, has been found to have overall higher quality of life for residents and higher family satisfaction. They've also been found to provide higher staff satisfaction, which means less turnover of the direct care workforce in particular. And once they're up and running, they have similar operating costs to traditional institutional settings. But capital, getting those things started, have been a barrier in Michigan. And that's where AARP, these one-time federal funds, could be invested in Michigan to help increase the existence of increased access that people will have to these other alternative sorts of settings.
This is Alex. Thanks for that, Lisa. Paul, what's your advocacy priority right now, or what would you like lawmakers to be considering right now?
Basically, a couple different things. One is that it's really important to find a permanent funding stream. I think the AARP money is really important to be able to get a sort of kickstart, but we do need to have that permanent funding stream for more affordable and accessible housing, because one of the big barriers for people to get out of a nursing home, transitioning them back into the community, is that there's not enough affordable and accessible housing. I think another thing that's we're pushing for quite a bit is to see a permanent increase in direct care workers' wages, along with being able to try to build that prestige and the importance of what direct care workers have, so that it's not seen as a lowly job, that it's seen as it is an important job to be able to help people stay in place to be able to have services delivered at home. Those are the two big ones: affordable and accessible housing and increasing wages for direct care workers.
Great. This is Alex again. I appreciate that. My ears certainly perked up earlier in our discussion when you mentioned specific pieces of legislation you're working on, because I also do a weekly discussion on the League's Facebook page on public policy issues, and I'd be interested in bringing you on again to talk about some legislation currently before the legislature that you're working on. So thanks for that. Now we'll bring on Casey and Julie and pose that same question to them. What is your advocacy ask right now? What is your appeal to lawmakers as we continue to advocate for housing needs and other policy needs for Michigan seniors and people with a disability? Casey, you want to go first?
This is Casey. Thanks, Alex. The first thing I'll say is just we need to make that mental shift of whenever we are talking about affordable housing to also think about accessible, affordable housing and boosting up that percentage that is required for affordable housing units to include more accessible housing options. In addition to what has already been said, I would just add some little modifiers on. Obviously, we want to build accessibly from the start, increase our accessible, affordable housing stock, and we want to increase funds for modifications and repairs. But we also need to make sure that we're not gatekeeping those funds for just homeowners in nice houses, right? We also need to make sure that renters and people who need home repairs can also access those funds. In addition to having more robust home care options, which has already been talked about, part of that is not just saying that there's home care available, but that there are truly options for people to choose the type of home care from which agency, from which area, with specific employees, so that there is more agency and choice involved in this process. And on top of all of that, right, we're talking about housing specifically. And I think sometimes when we think that, we're thinking about the physical building that people are living in. And we think that, you know, once they're able to live in that house, that's all community living is. And that's truly not the case. There's also this important conversation about having robust paratransit and public transit options for people to still engage in their community, because that's truly part of living in your home, is being able to engage in your community as well.
This is Alex. Thank you again. Julie, if you could answer that as well. Again, a lot of our discussion today has been focused on a research report that you put together that includes lots of policy recommendations. So I think you're well positioned to share some of your appeals right now, but kind of given the scope of the report and kind of the climate we're in addition to what others have shared, what would your ask to policymakers be right now or in the coming months as they begin negotiating the state budget?
Thanks, Alex. This is Julie again. In addition to what has already been shared, I would just say in general that our policymakers need to keep our communities of disabled people and older adults in mind at the forefront of their policy and budget discussions. It should never be an afterthought, no matter what the topic is, whether it's housing, education, transportation, employment. You know, as our panelists have mentioned several times today, when you make a more inclusive environment for people with disabilities, for people with older adults, you know, when you design things that work for everybody, we all benefit from that. So this, you know, this is not a bipartisan issue. This is not a regional issue. This is something that affects people in communities all over the state, and will affect each and every one of us at one point or another during our lives. So I would just ask them to keep that at the center of their decision-making process as they move forward.
All right, great. This is Alex again. Thank you for that. Julie, thank you again to all of our wonderful panelists and the organizations they work for, all of the great work they have been doing and continue to do. In particular, thank you to all of you for joining us today. Our reports and research and policy recommendations are strengthened by each additional person that hears them and takes up advocacy for those as well. So we hope that this has been both informative and inspiring. Certainly a lot of opportunities in the coming months for advocacy, both with additional American Rescue Plan Act dollars and negotiations on the Michigan state budget for 2023, as well as additional federal policy addressing housing needs in lieu of Build Back Better. Hopefully another similar alternative will be introduced soon, and we will continue to keep you posted on all of that. So thanks again to everyone for being a part of the discussion today. As a reminder, if you are watching this on the recording, we closely monitor our comments and our page at all times. So if there's anything you'd like to ask any of our presenters, you post that in the comments and we will get back in touch with you. Thanks again to everyone for being here, and have a great weekend. Thank you. And thanks to Carmen as well for interpreting for us today. I really appreciate it. Thanks, everyone.